calling this joint subcommittee of Ways and Means on General Government to order this Wednesday morning. Madam Secretary, may you please take the roll?
Senator Gokachia. Here. Senator Harris. Here. Senator Neal. Here. Assemblywoman Backus. Present. Assemblywoman Brown-May. Here. Assemblywoman Kasama. Here. Assemblyman Miller. Here. Assemblyman O'Neill. Here. Chair Peters.
And I am here. Everyone is present this morning. Thank you all for being here. So today we have a couple of business and industry budgets to hear. We're going to take them a little bit out of order, switch them up because we have some folks in Las Vegas who need to testify this morning on budget account 4680. So we're going to start there. Just a side note, housekeeping, turn off your electronic devices or at least mute them so we're not interrupting people as they're speaking. And we will have public comment at the end of the meeting today. I would like to invite Terry Reynolds et al. To the table to introduce this budget and tell us a little bit about what you're doing. Please proceed when you're ready.
Terry Reynolds, Director for BNI, for the record. Thank you. To my left is Perry Fagan. He's our Interim Deputy Director in Carson City. And to my right is James Hansen, aka Dale Hansen, our ASO4 with our in our fiscal unit. Today we're going to start off with the Division of Industrial Relations. We have Victoria Carrion in the audience down in the Sawyer building to be able to go over her budget accounts and the enhancements we have for you. DIR administration administers workers' compensation, occupational safety, health administration, safety consultation and training, mine safety, and mechanical compliance section. If you remember, there's 5 units, each individual units of industrial relations in the state. They have offices in Las Vegas, Carson City, Reno, Winnemucca, and Elko. So they're spread out through the state. With that, I'm going to turn it over to Ms. Carrion to go through the enhancements that are before you today in budget account 4680.
Good morning, Madam Chair, members of the committee. Victoria Carrion, I'm the administrator at the Division of Industrial Relations. And joining me today, we have Valerie Hall, who is our Chief Administrative Officer of the Workers' Compensation Section, as well as Haley Whedon, who is our Business Process Analyst. So the Workers' Compensation Section is responsible for regulating the workers' compensation system in Nevada. We don't actually administer claims or make decisions on claims. We don't handle the adjudication process, but what we do is we regulate and ensure that employers and insurers are complying with all of the workers' compensation requirements in Nevada. So we regulate about 100,000 employers. We regulate about almost 600 insurers and third-party administrators. And then we also regulate healthcare providers and ensure that they are complying with the workers' compensation system as well. So our key enhancement that we have before you, we're happy to be telling you about today, is an improvement to our database system for workers' compensation. And it's called the Claims and Regulatory Data System, also known as CARDS. So the enhancements that you're going to be hearing about total $2.1 million, and they are really aimed at streamlining our financial transactions, improving security, improving services to our external and internal users. So the system works very well currently. It came online in 2017, and we just had limited funding at the time. We only had $2.4 million to create a custom system. And so there were some components that we just didn't have enough funding to do. So now, several years later, we feel now is the time to really improve the services that we have both to external and internal users. So for external users, one of the key things that we heard from our stakeholders that we convened was that they really wanted to be able to submit online payments. Currently, that's not possible. They also really wanted to run more robust reports and have those being able to look at statewide information. Currently, they can only look at their limited information and compare it to statewide, but it's very limited. the kinds of reports they can do. There's also some data reports that we have insurers send to us, and it's all a manual process right now. We have a claims activity report that has a lot of annual information about workers' compensation claims that each insurer is supposed to send to us every year. It's a very manual, time-consuming process. If we can get that into cards, it'd be much easier for both the insurers as well as our staff. We also have an occupational disease report we're required to do statutorily each year, and all of that information is sent to us manually as well. So being able to put that in online for our stakeholders would be much easier for them. Another key issue is we have hundreds of requests every week for requests for a rotating rating physician. So this is when a injured worker is ready to get a disability rating to determine their percent disability so that they can get their permanent partial disability payments. At that point, they need a rating physician, and our office is responsible for assigning those rating physicians. Well, the requests currently come in via fax, via email, and it's a very inefficient process. So being able to have users, which would include insurers, attorneys, injured workers, being able to submit that form online would be much easier. Also, we would allow new users, new types of users, as I just mentioned, to submit reports and requests. So currently only insurers have access to cards, but this would broaden it to some of those other groups of people that I've mentioned earlier, like attorneys and healthcare providers and injured workers. Another key issue that we are trying to improve for our external users is the assessment data. So the entire workers' compensation system in our office is funded by the workers' compensation assessment. And that assessment data is currently submitted to our Department of Business and Industry fiscal staff and in paper form, and then it's entered into a separate database. We really want to integrate all of that into the card system so that all of that assessment data would be submitted online, and then the insurers would be able to view their assessments and their invoices online and be able to pay them online. That would be a tremendous efficiency gain from the insurer perspective. On to the next slide. The other key things we'd like to do is create some efficiency for internal users. So the enhancement would enable us to add electronic signatures to internally created documents. We send a lot of letters like to employers telling them, you know, our records show you don't have insurance for workers' compensation, please provide documentation, et cetera. All of those kinds of letters are generated out of the card system. However, there's not an electronic signature on them, so there's a lot of paper processes where we have to sign them, scan them, et cetera. So doing this would save us a lot of time. We would streamline management of the card's user accounts. Right now, we have a lot of manual processes where we have to manage the users and approve users. This would allow us to more easily manage users now that we're going to have a lot of different types of users accessing the card system. Also integrating accounts receivable and accounts payable into cards. That's all part of that online payment option. Being able to integrate that into our accounting system would also streamline the collections for assessments, fines, and penalties. And then also, just in general, these improvements would improve staff efficiency, provide more time for us to do investigations, analysis, et cetera. So we really think that doing things more efficiently would be of great help to our internal users. And then another key benefit of the system improvements that we are proposing is that we would improve confidentiality and security. I mentioned earlier that we get hundreds of these requests for a rotating rating physician. All of those include Social Security numbers. Those are currently sent to us via email and fax, which is not a secure way, and we would really like to move that into the card system so that we improve the confidentiality of Social Security numbers as well as all of the confidential health information that is included in those forms. On to the next slide. The other enhancement that we would like to propose is some scheduled equipment replacements, including servers, routers, and switches. The amount is $212,000 in the first year of the biennium and $11,000 in the second year of the biennium. And these are routine replacements. Most of the major IT equipment for our division is included in this 4680 account. And with that, we're happy to answer any questions.
Thank you. Mr. Reynolds.
Terry Reynolds for the record. Thank you, Ms. Carrion. Just wanted to make sure that this has been a system that we have met with the users over a period of time on workers' compensation to make sure that it's serving their needs. And frankly, these additions will really help from their process in terms of them being able to input information easily. On the other side, it also helps the injured worker to making sure that they have the most current access to healthcare providers for their ratings. That has been an issue over the past in terms of we had manually, we had a lot of physicians who were not doing that work anymore or adding people in that were coming online doing that work to make sure we were updated. And so we had the most updated list for our workers' compensation individuals that were accessing the system. So these are some of the things that were incredibly important that we now can add into the system. And as Ms. Carrion has said, it will really help both sides. It'll help the worker, but it will also help the businesses that have an injured worker to make sure, and the providers that we work with, the insurance agencies. So this is something I think that's sorely needed for the overall system, workers' compensation system. Thank you.
Thank you for that. Can you clarify, this is a state-owned, not a licensed product that currently is what we're working with right now?
Victoria Carrion for the record. Yes, Madam Chair, the system is owned by the state, so we own all of the code.
Thank you for that. Okay, are there questions from the committee? Yeah. All right, Ms. Neal.
Thank you, Madam Chair. So I just had a couple of questions. I don't know if I should ask Ms. Carrion or you, Director Reynolds, about, so I guess the data system that you guys did in 2017, it was a commercial off-the-shelf version. What was not included in that version that now you need today? Because it's a short time period, and it's my understanding that it was probably purchased in 2015, but then it was actually implemented in 2017, but we're really in 2023, and so that's a short time period around online payments and other efficiencies that we've had in our ability to do our work. So I wanted to know, give me the comparison between the two.
Terry Reynolds, Director for the Department of Business and Industry. Just going through the time frame, yes, it was budgeted for in 15. We actually worked through, we had an in-house programmer and IT staff that worked with to set up the system. For that, we worked with the vendor that we had purchased the system for and then made modifications to that. I always have to add 2 years because of the pandemic, so it's actually been 6 years that we have been working through that system. So with that, I'll let Ms. Carrion explain and her staff the differences in terms of where we started, what we had initially at that time, and what we're adding at this time.
Thank you, Victoria Carrion, for the record. So the initial system allowed insurers to submit information on each claim throughout the life of each workers' compensation claim. So that was one of the key elements that it included. And then it also included the ability for our internal staff to record all of the information that we had as we would do investigations in our employer compliance unit, to levy fines and penalties. And then in our audit unit, it allowed us to track our audits in there. For our medical unit, it allowed us to track the assignments of rating physicians and link them up to the claims. So it had a variety of components for our internal users. However, it was lacking numerous things. First of all was the online payment capability. It was also lacking the ability for external users to submit anything other than claim information. So they couldn't submit any reports to us, and so that's one of the things that we're trying to add in now, ability for them to submit data that we require annually on our claims activity report, the occupational disease report, and then most importantly, these requests for the rotating rating physician. That will be a great enhancement to the external users to be able to submit all of that information, as well as being able to submit the information required to do the workers' compensation assessment. So you can see that, we had some key components early on, and we really need to add additional components to make the system much more user-friendly.
Thank you for that. And I just want to ask a question. When you first started, you said that system that was, I guess, purchased in 2015, implemented in 2017, that was $2.6 million that cost?
Victoria Carrion, for the record, to Senator Neal, it's $2.4 million was the initial
2.4.
cost.
Okay. Okay. Well, I guess, I wanted to ask because it seemed like a lot of money for a system, and I know you weren't director in 2015, Director Reynolds, but it just seemed like a lot to pay for a system that with 100,000 users or businesses that are using the system. I know they have had to complain about walking in with a check and a money order every time that they are assessed. So I just wondered why that efficiency was not a part of the 2017 version. So that leads to the second question: how will the current process, this new system for 2.1 million, improve the resolution of workers' comp claims?
Victoria Carrion, for the record. So this system doesn't really handle resolution of workers' compensation claims. So if the resolution of claims is done at the insurer level, they are the ones who decide whether to accept or deny a claim. If it's contested, that process goes through the hearings division. So none of that is tracked through this system. This system really helps us to regulate the employers who are required to provide workers' compensation insurance and the insurers that are required to follow all of the laws. So it's separate from that. So it doesn't really help us to, it doesn't help the claims process move smoother. It does help the regulatory process move smoother.
Quick follow-up. Please go ahead. Thank you, Madam Chair. So is there a conversation to try to get a system that helps you with both the regulatory and the resolution process, or are they in different spaces? I know it could be an apple and orange situation, but I guess being that when you add the money together, technically this would have been like, what, $4.5 million on the system. When we look at 2017 to now, trying to make it all make sense so that the money goes further for the needs that you really are going to encounter as an agency, and just spend $2 million once, get everything you need, and then it's all settled.
Terry Reynolds, for the record. Thank you for the question, Senator Neal. The issue is their separate process. The evaluation is done by the insurance companies and doctors. I'll vow on that. With the system, though, in terms of the healthcare providers that provide the evaluations for the workers, that's part of this system. So on our side, we make sure that those lists are current, that we have additional people, enough people to be able to serve. So when evaluation needs to be done, you actually have those providers that can do that evaluation, and that we find that we know where they are within the state, because this is not just in the urban areas, it's the entire state. So we have to make sure that we're serving the needs of all the workers throughout the entire state, and we have updated lists, and we can input that information in so that the insurers and medical providers have access to that, and make sure that they know and they can access the system easier. That speeds up the process. And I think provides a more fair evaluation of the workers when they're injured, their disability.
Thank you, Madam Chair.
Thank you. I have Assemblywoman Brown May. Please go ahead.
Thank you, Madam Chair. Thank you, Director. I just have a question relative to the payments. If we're going to move into an electronic payment system, what does that look like? Are we able to take credit cards? Is it direct payments only? Do I have to do a transfer? And then how are we looking at fees? How will that handle?
Terry Reynolds, for the record, that's an excellent question in terms of that. I'm going to turn it over to Ms. Carrion to go through that, but that is part of the advantage of this type of system is being able to track and input those payments within the system, but go ahead.
Thank you, Victoria Carrion, for the record. So users would be able to submit credit card payments if they would like to. There would be a transaction fee that's part of the Wells Fargo fees associated with sending online payments to the state. I think we would also be able to receive wire payments as well, and those I think are required for the larger sums. So when some of the larger insurers are paying their workers' compensation payments, assessments, they would be sending us a wire transfer.
Thank you for that question. I think we all know from the history of these functional systems that these are questions we have to ask to ensure we're covering ourselves as we move forward. I have a question about functionality between the development of this software database in 2017 or between 2015 and 2017 and today. What does your in-house tech capacity look like for addressing in-house issues or build-outs of the system? And will you maintain that? Like, how will that interplay with the build-out of the system?
Terry Reynolds, Director. For the record, I would tell you that we are consolidating our IT functions within the Director's office, and actually I was going to go over that in the first part of the presentation, but we skipped over to this one. But we have really been able to establish an IT unit within the Director's office, and we do have from IT professional positions to IT pro positions that are able to handle and monitor this type of work, and so it's been fairly effective. So when we have a new system that we're implementing or updating that system, we can put the resources available to that. And we're transferring the two IT people that we just hired actually for DIR into the Director's office so that we can utilize them in concert and train them in concert with our existing hierarchy of IT staff within the department. So this has actually proven to be pretty efficient. We're lucky that we have most of our functions in our agencies in one location at 3300 West Sahara or in Reno. So we've consolidated our locations and consolidated our staff to be able to work in those areas. So it's been actually fairly efficient. I will tell you that it's taken a while to get to that point, and it's been very difficult to hire IT staff within the state because of the salaries we pay. But I will tell you that this action by consolidating and having a team approach to that has been looked at more favorably by the people we're trying to hire. And there's been the more able to come to work for us. My deputy director, Perry Fagan, has actually done the interviews and the hiring with our IT team on that. And so I think he can provide some background on that. But I want to tell you that we have been very successful in attracting good people the way we're approaching our IT functions.
Perry Fagan, Deputy Director, for the record. We've spent several months working through the process of hiring IT staff. As Director stated, it's been very difficult because of the salary process and finding people. We've had several that we've looked through and have made offers to, which were summarily just declined because of pay issues and things like associated with that. However, we've recently hired several staff members which have been put in place over the last I would say probably 30 to 45 days. So we're trying to get them up to speed now with the current systems and what our entire process looks like, and get them involved and keep them moving forward. So it takes some time, obviously, because the state does things a little bit differently than sometimes the private sector and even other state agencies. So we're working through that process, but we're getting there.
One of the things I want to point out, Terry Reynolds for the record, is our core IT staff has been there since for about the last 9 years. And most of them have been there for like 6 or 7 years. So we're very lucky to have that core staff available us to be able to, when we bring people in, to train them and work with them. So that's been really an advantage to our department. So the top 3 positions within our department have been there now for 9+ years.
That is pretty amazing and great for continuity, at least. We do worry that sometimes that institutional knowledge of how things work when they leave doesn't get passed on, but it sounds like right now we have a good lineage of folks who have been staggered in for a while. I just want to confirm that this build-out is expected to stay within the biennium cycle. Is it expected to go beyond 2025?
Terry Reynolds for the record, it is anticipated that we will have it complete during the biennium process.
Great. Thank you so much. Are there any other questions on this budget? Not seeing any. Thank you so much for being here. Thank you for joining us in Las Vegas. We're going to move on to the next budget. I think Director Reynolds is going to stay up here with us and go through budget 4681 with us. Please go ahead when you're ready.
Thank you. This is Terry Reynolds, Director for the Department of Business and Industry. I'm going to go through kind of a high-level overview real quickly, and then we can get into the budget accounts and budget enhancements. Under the Director's Office, the Business and Industry has our fiscal unit that does our budget, contracts, payables, receivables, purchasing. We have the Office of Business Finance and Planning, which is our Small Business Resource Center. Our Minority Affairs Commission is within that office. We have the Consumer Affairs Unit and the Ombudsman for Minority Affairs, Miriam Hickerson-Laura. We also have our Central Information Technology Unit, which I spoke about. Under the Director's Office for the direct supervision, we have obviously administration. We administer all of our 11 different agencies, plus the Director's Office. We have private activity bonds that we oversee. We're the conduit issuer for bonds within the state. We also have New Market Jobs Act, which we oversee through Mr. Chris Wise, who does an outstanding job with that. The key budget enhancements that we have for our department is E711, replacement of video conference equipment at the Nevada State Business Center in Las Vegas. Fiscal year 24 is $115,198, and for FY 25, there is no expenditure for that. When we put together the Business Center, we consolidated our agencies within that. We actually saved quite a bit of money by doing that. We were able to purchase reconditioned video and sound equipment for conference rooms. Currently, we have 4 boardrooms used by the Employee Management Relations Board, the Taxi Authority Board, the Real Estate Commission, the Common Interest Communities and Condominium Commission, the Athletic Commission, who used to be under BNI but now is still in our building, so they use that, and we cost allocate that time for their use of that. We have the Nevada Commission on Minority Affairs. We have the Nevada State Apprenticeship Council, Mortgage Lending Division, Financial Institutions Division, and the Division of Industrial Relations. They all use those facilities. The facilities go from capacity of about 65 or 70 people down to 25 or 30 for some of our smaller rooms. We do a lot of work with community groups that we interface with our Office of Business Finance and Planning. So we may have a seminar put on by the Department of Labor. We have entrepreneurial groups that we work with that use those facilities to have meetings. We have our business roundtable that we have where we bring in both online and in person about 85 to 90 individuals to hear programming from everything from the SBA to our office to the chambers. So we work very closely with the state, and we use these rooms to facilitate those discussions. We have the ability to be online and present programming, which is also recorded, so you can access it later. But we present that online so people can access it from every area in the state. So that's what we have for that. The equipment is currently, will have been in the State Business Center in this March, 6 years. The equipment has actually held up very well, although we're patching some things and repairing some things as we speak, but it's been doing okay. E301 is, in addition, in-state travel and education materials for the Commission on Minority Affairs for outreach to the rural areas in Nevada. For FY24, it's $10,316. FY25 is $10,613. I also have, I think in the audience is Commissioner Taylor, who's the chair of the Minority Affairs Commission. They're available for questions, I believe, on that. The additional travel will allow to connect and engage with Nevada's 28 tribal nations in rural areas. Also partner and collaborate with the Nevada Indian Commission, Pershing County Economic Development Authority, Rural Nevada Development Corporation, Economic Development Authority of Western Nevada, and the Reno-Sparks Chamber of Commerce. We connect and engage with the Washoe County Sheriff's Department Community Outreach Program and launch Rural Nevada business events in Elko. So this is what the enhanced travel will provide. And I can't say enough about the Minority Affairs Commission. You all select the members to that. They're appointed by the Legislative Council, but they do an outstanding job in terms of research, education, working with community minority groups within the entire state. And this will allow them to have that extra outreach for their programming. I'll leave you, they have a very nice brochure that really explains what they do, and I'll leave you copies of that so you can see that. Last one, E300, allows the Consumer Affairs Unit to charge initial and renewal registration application fees to companies that are required to register as a structured settlement purchase company. This was enacted in the last legislative session. It did not provide for them to collect a registration fee. There's, I think, about 24 companies that register that are involved in structured settlements, and this would allow the Consumer Affairs Unit to register them and collect a fee for that registration. The budgetary bill draft is authorizing Consumer Affairs to charge an initial and renewal registration application fee of $250, late registration renewal of $375, and a registration reinstatement fee if it lapses of $500 for structured settlement companies. The proposed fee will incentivize timely registration renewal and will penalize entities that allow their registration to lapse. I will tell you that we didn't have the ability to collect the fee because we didn't have an authorization, but companies were sending the fees in to us anyway, and we had to return those fees. But we'll be able to do that assuming that this passes. Revenue from the fees will be used to acquire technology for the improved technology used by Consumer Affairs. We use a database system as a caseload management system, and Consumer Affairs to manage our cases on that. And I'm happy to tell you that we had about We're averaging now about 3,500 cases for the Consumer Affairs Unit, and we've done actually fairly well in resolving those. We're exceeding a 90% resolution rate for those cases. So this will help us keep our technology up to date for that system. And those are the enhancements for the Director's Office. Be happy to answer any questions.
Thank you, Director. I do have a question on E300 that we just touched on. So it sounds like the anticipated revenue from this new fee structure is expected to be $5,250-ish in each year of the biennium. Can you tell us how that amount will affect how the division it functions? Like, what will that amount help with?
Okay. So we use, Terry Reynolds for the record, we use what's called an eyesight data system, and it's a case management system. And so basically from time to time it needs software upgrades to be able to handle our case management system. And so that money that we would collect from that will go directly into the case management system. The system actually produces reports for us. It manages basically each individual case. That's every time we get an inquiry on a consumer, we put it into the database, into the management, so we can keep track of each individual case. It also is done by what type of case. For example, we know that this last year we had auto shop repair. We had 249 cases come through. We know that we had telemarketing. We had 14 timeshares. We had 99 cases. So we know what type of cases we have, and then we track the length of time involved in that. So we're registering the cases and the companies that we work with on that. This will help us be able to keep better track of the system numbers. It'll keep better track of the cases and their resolution to make sure they don't get lost in the system, and we can go through. Keep in mind, we only have 7 people statewide, and we handle about 3,400, 3,500 cases a year. So we have to be fairly efficient in the handling of that for our investigators.
Yeah, just compared to the request for build out of the other database,
Yes.
this is very nominal amount to add to infrastructure. So I just wanting to make sure that it's an especially because of how the bill will have to come through, that it's worth the fight for that $5,000 a year.
No, Terry Reynolds for the record, and that's a good point. But I will tell you that it's a very simple system, but it's very integral to because of the staffing that we have and the ability to be able to work with these cases. We also get referrals back from the Attorney General's office, and we work with them concurrently on cases. We work with the Fight Fraud Task Force within Clark County. We work very closely with the police and sheriff's offices on scams and problems with seniors that they have in terms of telemarketing and phone calls. So this also helps in terms of making sure that we can see similarities in cases across the state. And when we have our fraud task force meetings about every month, we can compare information with the local jurisdictions to make sure that we're on top of those. So it's a very, although it's a low-cost system, it's a very integral system for us.
Thank you for that. Assemblywoman Backus, please go ahead.
Thank you, Chair. I just had a quick question. I wasn't here in 2021 when this law passed. So with these structured settlement companies, are they, I know that a lot of them are also insurance carriers, and so I would take it they're regulated by both of these different, under Division of Insurance, as well as having to participate in this division as well?
Terry Reynolds, for the record, we don't regulate them in terms of, we register them. So they are registered to do business within the state. And if there are problems with them, then we know the companies involved, and then we can turn it over to regulatory agencies. We work with the Attorney General's office on that if it's an issue. But mainly if these are civil, non-criminal types of consumer issues, then we deal with it. If there are, so basically it's a registry. It's the same thing we used to do with sellers of travel. We registered them. That's probably going to come back, I think, in this session. We had a very successful law, and when they did away with the authorization of the consumer unit, and we had to basically, it was reenacted, and then we funded it every biennium, basically, and now it's been permanently funded. But we were able to add some of these issues that we had where we needed to have the companies registered that do business. We've been able to keep that up and now start registering them again.
Thank you. Senator Neal, please.
Thank you, Madam Chair. I had a question on page 2. There are a couple of questions. I know your agency does a lot, and I have an interaction with a lot of the individuals that work there. But under the work that you guys do for OSHA, how exactly, like if there's a complaint that comes through and it's a business that's not doing that, I guess, safety, what's the process of going and reporting that company? Is that an easy process for an employee to do?
Terry Reynolds, for the record, I don't know if Administrator Carrione's still there, but it is an easy process to be able to do that. Terry?
Deputy Director Perry Fagan, for the record. Senator Neal, if I understand the question correct, how can someone make a case or a complaint with regard to safety or OSHA?
Correct. And if you could add, is there a fine or fee attached to like a resolve complaint? Do you have the ability to fine a company that's not performing?
So there's 2 parts to your question. First part is anyone can file a complaint with Division of Industrial Relations OSHA unit. They can do it anonymously, and they can do it through the federal OSHA website, okay? Or they can contact us directly at our offices in northern Nevada or southern Nevada. And throughout the state, we have the ability to email complaints or questions, as well as filing them anonymously through the federal website. As far as fines are concerned, that's something that basically comes out of a potential investigation, and it really depends on what the situation is. So maybe not everybody would get a fine or have an investigation done on every single complaint that's filed, but it really depends on what happens as a result of the investigation. And that's something I can also follow back up with you on as well for our OSHA administrator.
Thanks, Madam Chair. I'm just wondering about it and whether or not those fines are recycled back into the OSHA unit to then continue that work.
No, those fines are I believe, sent off to the general fund, I believe is how that is handled. We don't keep those.
Thank you for that.
Actually, Dale Hanson for the record.
Thank you.
Those fines actually, I think most of those go back to the workers' comp fund. And then that stuff is, OSHA gets an appropriation. They also have federal funds, but they get an appropriation as well that goes towards their activities.
Thank you for that. So I'll leave those questions. I want to talk to you guys offline. I have like a series of questions about stuff that you posted on page 2.
Thank you so much for that. Assemblywoman Brown May.
Thank you, Madam Chair. I have a question relative to small business. There are a number of moving pieces and parts in both the governor's budget, the lieutenant governor's budget, and business and industry. And it seems like there might be some overlap. And so I'm curious to know, is there anything, if small business moves out of the lieutenant governor's office, what are the implications to business and industry and the ability to serve small business out of your agency?
Terry Reynolds, Director for BNI, thank you very much. I'm thinking about processing the answer. Thank you very much for the question, Assemblyman Brown May. The issue we have is that we dedicate a variety of resources to small business, whether it's through our consumer affairs, handling complaints on a customer basis, whether it's an ombudsman that works with a business in terms of the issues that they have, and especially with minority businesses, keeping in mind that we have probably 70-some% of our businesses within Nevada are under 100 employees. So very much that we have a small business community within the state. We dedicate an incredible amount of time and resources to making sure that small business knows where to go, how to access resources for everything from purchasing, employment, legal issues to where can you get licensed. If I'm expanding into another part of the state, how do I get my license there? We have a roadmap that's been developed by our office that was developed internally, and it's interactive. So you literally can click on a series of topics and get that information down to the local level. So it will tell you, for example, how to contact to get a license in Elko, Nevada, or Winnemucca, Nevada, or Reno, or Washoe County. It'll tell you what resources are available to you to be able to do that. It'll tell you about what purchasing programs are available for you, how to hire people. So we provide all those resources. Can we be all things to all people? No. We work very closely with the small business development centers, with the university. We work with the SBA, the Department of Labor, and having programming to be able to help individual businesses. We also work with the Cooperative Extension Services, both in Southern Nevada, Northern Nevada, and the rural areas to make sure that our businesses can tap into the programs that are being offered or funding that's being offered through the continuing education. There's a lot of seminars and programs that are available. We work very closely with the universities. We work with for data, for example, and that's a major issue for our businesses, being able to know what their markets are, how to access that information, how to get assistance in terms of determining from down to a zip code level, what can I expect to see in dollar amounts if I start a business there. So those are the types of things that we offer within business and industry. To be real frank with you, we have worked very closely with the Lieutenant Governor and their ombudsman, their small business person that has brought issues to us, and especially with local governments, people trying to interface with local government and licensing issues within the state. We will continue to do that. But I think we provide, we're probably on the balance of providing most of those services that you see. We have been involved in that probably very strongly for the last 10 years doing that. So we have a good database. We have a good system to be able to help businesses, and we're continually on a monthly basis getting feedback in terms of what we need to present, what we need to help, and where we can help.
Thank you so much. We had a clarifying question. Did you say you do have zip code data, or that's the piece that's missing?
The small business development centers through the university have data down to the zip code level. Actually, they can do it down to the block level. In my previous life as a city manager, we had businesses come in and they were looking at locating within a particular location within the city. We would direct them to the small business development centers and they could get that data to show what the existing businesses were doing within that area, within that zip code, or even down to the block level, to be able to decide if that was a good location for them or the types of products that could be offered within that area. Now, sometimes it's the reverse of that, where we see holes within communities that we need to see those services provided. So that's also available, and a lot of businesses are looking to see that, where we are deficient within our communities and where we need to locate. Senator Neal knows quite a bit about that one.
Thank you so much. Are there other questions for this budget? All right, seeing none. Thank you so much for your time today. Appreciate it. That was the last presentation for today, so we will close out with public comment. If there's anybody in the audience here in Carson City, please come up to the table. We are limiting public comment to about 2 minutes to ensure that we are able to make it through everybody and have equity in your ability to present. You are welcome to send in comments via email, snail mail, or fax up to 24 hours after the committee. I don't see anybody in Carson City, so we will move to Las Vegas. I do see someone at the Las Vegas location. Please state and spell your name for the record, and you have 2 minutes. You make sure that you turn on the mic in front of you. There's a little white button that will light up when it's on.
Thank you, Madam Chair. Good morning, Commissioner Kathleen Taylor for the Nevada Commission on Minority Affairs. For the record, thank you so much for your consideration of our budget enhancement. The Commission is Nevada-born, Nevada-strong, and we will continue to fulfill the mission and purpose of our commission statewide, specifically within our rural communities, by trying to provide assistance, capacity to those rural entities that we could potentially partner with and establish collaborative activities to better serve Nevada's minorities that are residing in rural areas. So thank you so much for your consideration of our budget enhancement, and thank you very much, Director Reynolds, for your support. Thank you.
Thank you so much for your comments. Is there anybody else in Las Vegas? Not seeing anybody approaching the desk. BPS, is there anyone on the public call-in line for public comment today? BPS, we're not hearing anything from you in the committee room. Can you let me know that you're there?
Sorry, Chair. The public line is open and working, but there are no callers at this time.
Thank you so much. We'll close out public comment. Are there any discussion items from the committee before we adjourn? Seeing none, we are adjourned. Thank you so much.